More than ever, patients expect a retail experience from healthcare throughout their journey. Automation in healthcare processes and digital front doors are essential to meeting patient expectations and improving care delivery. Today, I'm talking with Angela Yoakum, EVP and Chief Transformation Digital Officer at Novant Health, about the change in mindset driven by digital healthcare and how new technologies are building a better healthcare future. Angela, welcome.
Thank you. It's good to be here.
I'd love to know first, tell me how you define your connection to purpose. In other words, what gets you out of bed every day to work in healthcare?
Well, I don't need to tell you, healthcare is uniquely challenging. First, there's a heft associated with this field. Obviously, it's very important to everyone, but it's also interesting because of the interconnectedness of healthcare with every other field. You can't be a great healthcare leader and be heads down just in your own domain space. You have to have an understanding of the contextual understanding that expands far beyond the bounds of our industry as it is currently defined, which is constantly expanding and changing, by the way. So there's never a boring day.
Well, speaking of things that are constantly changing, you've been at the forefront of changes in digital transformation throughout your entire career. As you look at healthcare, what's the biggest mindset shift that needs to happen when it comes to digital?
Well, there are so many different players in the healthcare ecosystem. I think it's probably important for us to think about those opportunities for each player type separately. So for example, the payer community needs to allow its thinking to evolve around what sorts of things are reimbursed. We saw some of this last year in 2020 as they started reimbursing for video visits. But the landscape of virtual care is going to continue to expand. So must the thinking on how this care is reimbursed expand. Then, of course, the provider community likewise needs to challenge the traditional notion of a visit as being the most important touch point with a patient. What if we were to use digital capabilities to allow for a digitally enhanced or assisted management of health and wellness across the continuum of care? What are the options we could explore to help our patients and the communities we serve be healthier in general? And by the way, there is business differentiation there as well as we create a stickier environment in the consumer-focused sense while reducing overall costs of care, which has its own incentive model.
Well, what you're describing, Angela, is clearly a different model, both at the community level and at the organizational level. And so often we hear about, well, what will the hospital of the future look like? And COVID has obviously accelerated some of those things. But can you give us a sense for what do you picture when you look ahead 10, 15, 20 years of what does a hospital of the future look like?
So we can get into all sorts of trouble talking about what's going to look, what the world will be like in 10 years. I mean, change is so rapid. Let's start with what is emerging now and then see if we could trace it down to what it's going to be in 5, 10 years. So currently, we know today that advanced technology makes the relative geographic proximity of the care team no longer an issue for rural communities or communities who are otherwise isolated. We see this with our own, our tele-ICU capability, the advanced stroke care capability that we offer to a variety of remote locations, robotic surgeries. I mean, these are things that I think are in place, obviously, today in most sophisticated systems, integrated systems. And we're going to see, I think in the very near future, with some of the recent announcements that we've seen coming out of the various labs, highly personalized treatments are going to start becoming the norm. I think that the significant shift in healthcare and how we think about it, specifically as it relates to, you asked the hospital of the future. I think that we will not have as strong a delineation between, care, acute care versus ambulatory care versus, personal management of wellness. I really believe we're going to have a continuous monitoring of wellness in general, that allows us to think in terms of managing the continuum of care in a way that's more holistic and a little less fragmented than it is today.
Well, Angela, with that, I really want to thank you for your sharing your insights. Thank you so much.
It's been fun. Thanks for having me on.
So Angela, we're now going to enter what we're calling the rapid fire section of the conversation. And so I'm going to ask 3 questions and your best top of mind answer. First question, if you could wave a magic wand, what's the one thing that you could change about healthcare?
I would dump a ton of money into addressing the social determinants of care. And, I'd address the fragmented nature of how it's funded today.
Angela, you must be pitched by 1,000 startups. And I'm wondering, what is the biggest red flag during a pitch? Or perhaps what is the best green flag about a pitch that you want to share?
Well, it depends on what they're pitching. So for example, if I have, so I wear an investment hat. We have an investment fund here at Novant Health. I also advise a number of other funds. And so when I'm sitting in a deal flow meeting and we're thinking about, this startup as an investment opportunity, there's certain things I want to hear. So for example, I'm testing a simple example is I'm testing the appropriateness and the efficacy of the management team. What are the capabilities of the management team? The founder, who else is on staff? What are they going to be able to grow this company? What successes have I had in the past? But if I have my customer hat on, my large corporate customer hat on, and I'm thinking about being customer 0 or customer 1 of this startup, I don't really care about where the founder was before, and what drove him or her to start this company. I mean, that's irrelevant to me. What's relevant to me is the capabilities that can be brought. How easily can I co-create with them? Can I have an opportunity potentially to go to market together with something that we develop together? What is your viability as a company? I mean, I'm just asking different sorts of questions than I am if I'm a customer, an early stage customer, than I am if I'm an investor. And so, I think I often see startups forget to whom they're pitching. So, if don't give me your pitch for funding if you're actually just wanting to sell me your product. Those are very different pitches. So it's a contextual awareness issue.
All right, final question, Angela. You've built a reputation as a transformational leader, and not just in healthcare, but obviously in technology and other industries. So what's the best advice that you've gotten in your career, or what's the best advice you give to anyone who wants to pursue a career leading healthcare transformation like yourself?
Yeah, so transformation is not for the faint of heart. And, unfortunately, or fortunately, if you like it, as I do, healthcare is an industry under what will likely be radical transformation in the coming years. So as you think about entering a healthcare field, look back upon not fields that are close to healthcare as healthcare has existed, because healthcare is going to look very different than it does today in 5 years. So what are the sorts of transformational activities you've been able to drive across a variety of industries in which you've operated? Those are the activities that will be useful in healthcare. Also the other piece of advice I would give people is, we are dealing with the most complex systems known to man, right? The human body. And so, if you're coming in a position like the one I have, no one's going to ask you to see patients, so that's not going to be a problem. But someone is going to ask you to help them keep track of the advances that are happening in medicine. I think medical knowledge doubles every 30 days or 45 days or something like that. I can't remember exactly what the latest stat is, but wouldn't it be nice if we could find some way to help that knowledge management, help our clinicians with that sort of knowledge management? And that's just a single example. So yeah, it's a rapid, fast-paced, amazing, rewarding, fundamentally important field.